think we'll start. It's 8:30. I know one or two people are yet to come. So we're done with the GHRP. Yes. And I hope you all feel a little more confident of the content and other things related to GHRP. If there's still any other questions, we can still continue to discuss that. But today, then we get into implementation research. And all of today and some of tomorrow, we'll be doing, talking more about implementation research. Again, looking at your same proposals, and seeing how they fit into the IR understanding and framework. Before we begin, the first session is by Ari, where she'll do a short recap of the characteristics of an IR project, and then you'll have time to work on your own projects. But before we begin, I just wanted to say thank you for the feedback. And in the feedback, I just wanted to highlight two things. One is that there was one feedback on GHRP and IR, and that our protocols are not GHRP and IR compatible. So I just wanted to clarify that GHRP is good health research practices, right? And it's something that can be applied to all kinds of proposals and protocols. So any proposal or protocol that you have, whether it's implementation research or even an epidemiological design of study, good health research practices will and should apply, right? It's about ethics and quality, and therefore GHRP is not a design. GHRP is about applying good practices to any kind of design. So there ought not to be the thing of compatibility, because any project you should be able to apply GHRP principles. So I just wanted to highlight that. IR is, of course, a very specific kind of research, and therefore designs and things like that we'll talk about. But the principles of GHRP will continue to apply, as will apply with any other design. The second thing was, I think, about everybody not getting an opportunity to speak. So I think some people felt that they didn't have the space to speak. So today we'll be a little bit more mindful of that and try and get as many of you to participate as is possible, right? So please feel free to speak up, to engage, and to participate. So then I'll hand it over to Ari now, who will take the first session on recapping characteristics of IR.
Thank you, Dorothy. Good morning, everybody. Still sleepy? Okay, then I repeat my greeting. Good morning, everybody. Thank you very much. So, since this morning to tomorrow, we will focus to the IR, implementation research. For starting the course about IR, then I would like to facilitate you to have some kind of refreshing about the concept of IR. Particularly in the two concepts, first about the characteristic of IR. So we will get the same perception, what are the differences between IR and other type of research. The second one, then we go through more deeply about the type of IR questions. So two concepts we would like to discuss during this morning recap. So I would like to start with the IR definition. Sanders and Haynes mentioned in one of article in PLOS Medicine that IR is a part of health system research. So the focus of IR is the health system aspect. We know together that health system is a broad aspects. It consists of six building blocks. So it can be service delivery, health information, human resources, regulation and policy, and financing, as well as the medicine and technology. So it's implementation research is a part of the health system research. But I would like to emphasize the definition of IR to this aspect. So it's a subset of health system research that focuses on how to promote the uptake and successful implementation of evidence-based intervention and policy. So it's, again, IR is not questioning about the not questioning about the concept of innovation. It's questioning about the implementations of proven tools, strategies, intervention, and policy. Okay? Then I will continue to this definition. Yeah? Again by Peters et al. Yeah, in this article in BMG. So implementation research is a scientific inquiry into question concerning implementation. Again, the clue, the keyword of IR is questioning about implementation. What is actually the meaning of implementation? It is the act of fulfilling or carrying out an intention into effect. Yeah. So it's not about the instrument itself. It's not about the effectiveness of the instrument. It's not about the effectiveness of strategy itself, but it's more about the process of carrying out the proven tools, the proven intervention, the proven strategy, and the proven policy. Yeah. So I think this is something that we focused is the implementation of policy, program, or even individual practices. In IRs, it's called intervention. Okay. If we say intervention in IR, it means it can be policy, it can be program, it can be tools, it can be procedure, something like that. And that intervention is already proven by previous research or adjusted to be proven if it is, for instance, was. That's a international policy that is adjusted to be effective so that WHO promoted was. If we conduct IR about was, it means that the problem is about the implementation of was. It's not measuring the effectiveness of was anymore because it's already proven. But the problem is about the proven intervention in the research. When we implement that in the real setting, it can be different situation. Okay? So this is more for on the IR toolkit. You can revert to this website. So implementation research usually identify implementation problems. So the problem should be about the implementation. The problem should be about something that hinder access to the intervention, for instance, or delivery or services, as well as usability of effective evidence-based intervention and their main determinants. Can you see the difference? Yeah. In IR, we have strategy, policies, intervention that already proven, but there is something problems with its implementation in the real setting situation. The second one, implementation research usually develop and testing practical solutions. So because the problem is about the implementation, then we can introduce practical solution to the problem of implementation. In IR, it's called IR strategies. So intervention, practical intervention to improve the implementation of proven intervention. So we have proven intervention, but that does not work in the real setting. And then in IR, we can have strategy to improve the implementation of its proven intervention. Okay? The third one, so it can be also, we have already proven tools or services or intervention from, for instance, from RCT, randomized control trial. But then somehow when we would like to implement that in the real setting, we have to do some modification or adaptation. That's also a part of the IR characteristic. Okay? If we deal with the modification or adaptation with the evidence-based intervention tool and services, that's the focus of IR. And the last one, the characteristics of IR. We usually conduct IR to determine the best way to introduce practical solution into health system. So again, it's about the health system and facilitating their full-scale implementation, evaluation, and modification. So we can conduct IR when we have, for instance, we already piloted some kind of proven intervention, but it's still in the pilot phase. And then we would like to scale up that initiative into larger setting. In that situation, IR also can be take into account. Yeah, when we have to scale up the intervention into larger setting, we have to know whether the context, some factors related to the context will be very important to be considered when we scale up that intervention into larger setting. Okay, so this is from the IR toolkit from the TDR website. Yeah, again, this is emphasized that IR is not measuring the effectiveness of innovation. It's already proven, but then IR focuses about the implementation barriers and bottlenecks. Yeah, there's an innovation already proven. Can be technology or policy or program, and then we would like to have a optimal outcome in the real setting, but sometimes we have to take account into some barriers, bottleneck in the health system that influence that innovation. Okay? So this is again more emphasized from WHO TDR, because what we have actually, we have proven intervention from the previous research, but when we apply that innovation, that intervention in the real settings, we found suboptimal intervention. For instance, in Indonesia, now we are facing, for instance, we have very effective intervention like immunization, measles immunization. That's already proven that that's effective to reduce, for instance, the morbidity and mortality because of measles. But then when we apply measles immunization in the real setting in Indonesia, the coverage of the immunization is low. That's the problem of implementation. It's not the problem about the innovation, the immunization. It's already effective. But the problem is in the implementation of immunization in the real setting. Then we would like to explore what actually the barriers to the coverage of the immunization. So that's one example of question in IR. Okay? So because the IR intend to improve or to optimize the intervention to be effective intervention in the real setting. So that's why we have to explore what kind of bottlenecks to the low coverage of immunization, because after we have a practical solution that we would like to test in the IR, then we want to have more effective intervention. We want to have larger coverage of immunization. Yeah. So this is the things that usually explore or measured in the IR. this called context. So we can explore about the stakeholder context, health system context, or maybe some institutional culture and attitude, or maybe some physical factors, or maybe some political factors or cultural factors, as well as the socio-economic situation. So that's some example about the context. Yes, so this is something that to be the main characteristic of IR. First, it is systematic. So this is a systematic study that focuses in this it is relevant to real life situation. But on the other hand, we apply the rigorous scientific methods. Okay, so it's a balance between relevance to real life situation with rigors strictly adhering to norms of scientific inquiry. So in IR there is a part of research. I mean, we have to do some exploration about gap of knowledge, and then we have also to do with the scientific procedure. We have methods, research design, certain data collection, but the type of the question should be something from the real life situation. So it's about the implementation in the field. So that's why sometimes we need this one. So in the way we framing the question, it should be demand driven. So IR question usually develop by the involvement of stakeholders, because it's not only an academic exercise. Yeah, IR is not an academic exercise only. IR intend to provide practical solution to the real life problem. So that's why the problem should be discussed with the implementers to check whether that problem is really real, whether the problem is really perceived important by the implementers. And on the other hand, because this is research, we would like to have a generalizability of result later on when we have the result from the IR. It should be something that can be applicable to other settings. So it should be generalizable knowledge, can be applied across various settings. And because the question sometimes complex, so this is the other characteristic of IR. In the IR project team, we usually need a multidisciplinary team. Yeah, we come back to this. We come back to this context because the question sometimes touch more than one type of context here. What we meant by context here. So we need some expertises. So, for instance, if the context about the low coverage of immunization in Indonesia relate to the culture or maybe some kind of belief. So in the IR project team, sometimes we need, for instance, anthropologists in the team to help us to be properly explore about the factors related to the culture, related to the belief of people in Indonesia about immunization. So that's the example. So again, I would like to refer to this guideline. This is clearly explained to us what is the question that relevant to IR, what other question that is not relevant to IR. So IR is not relevant to prove the concept. IR is not relevant to answer the question about, for instance, whether the intervention is safe or whether the intervention whether the intervention works in the real life situation. So, whether the IR question, whether the intervention safe for the subject or whether the intervention works. It means that the question about effectiveness, that's not relevant to IR. But if we have question related to whether the intervention works in the real life setting, real world setting, that's relevant for IR because that's about the implementation. And if we have question about something related to the scale up of intervention into larger context, that's also relevant for IR. So these two questions that's related to IR, you can see here the 3 box here, that's related to IR, but the 2 box here in the left is not relevant to IR. You can refer to this document later on. So, this is some example about the use of objective and then research question in IR. We can use, for instance, the word to explore in the objective. If we would like to raise question about the identification of bottlenecks related to the implementation. For instance, like this. What are the possible factors and agents responsible for good implementation of health intervention? Or we can, in the opposite, raise a question, what are the possible factors and agents responsible for the problem of intervention, if we learn about the problem of implementation. And then this is the other example. This is the exploration about the possible factors and contexts responsible for enhancing or expanding a health intervention. So it's about the scale up. Okay. So this is the other example of the objective in IR and the questions. We can use the word to describe when we want to identify and describe the phenomena and try to look for the possible causes. So to explore and to describe, I think it's the matter about the how deep is your identification. If you want to go in depth description, then you can use the word to explore. If it is just a description, so it's more superficial than the ones in to explore, you can use the word to describe. Okay. And this is the other example about the objective of and research question. You can use the word to influence when you want to introduce practical solution to the implementation problem in the IR. You introduce and test that practical solution. So this is some example about the research question. Is coverage of health intervention changing among beneficiaries of intervention? I would refer back to the example about immunization, low coverage of immunization in Indonesia. Then, for instance, by systematic review, I found actually the mass campaign using the role of community leaders, for instance, to be effective, to increase the coverage of intervention in other diseases, for instance. And then I adopt that and then test as a practical solution to the problem of low coverage of immunization in Indonesia. So my question is coverage of immunization will be increased by the implementation of mass campaign about immunization by community leaders or religious leaders, something like that. We can use the word to influence. Okay. This is the other example. We can use the word to explain when we want to develop or expand a theory to explain the relation between concept, the reason for the occurrence of events, and how they occurred. So, for instance, the question is, how and why does implementation of the intervention lead to the effect of health behavior, services, or status in all its variation? So I think the question is more complex compared to the previous one, with this one. If we want to use the word to explain, it means that we are not only questioning about the changes, the improvement of implementation, but also what are the mechanisms to the changes. Okay? Because here the question is not only whether there is a changes, whether there is improvement, but how and why it's improved. Yeah. And the last one, this is some example. We can use to predict if we want to use the theory of prior knowledge to forecast future events. So we usually use this when we want to explore the context matter when we plan for scale up or we plan to introduce the innovation. Yeah. So, in the research, usually we always discuss about the variable, the concept that we would like to explore and we would like to measure in our research. It's called variables. Yeah. In IR, the terminology for variables is implementation outcome. So there is a certain terminology. Implementation outcome is the variable of the IR. So usually in IR, dealing with this type of implementation outcome, it can be acceptability, for instance. It can be adoption, it can be appropriateness, feasibility, fidelity, cost, coverage, and sustainability. So, if I'm questioning about why people reject the measles immunization in Indonesia, actually I want to explore about acceptability. I want to explore the level of a perception among stakeholders, this can be the community, that an intervention is agreeable. Whether the community actually agree with measles immunization. That's acceptability as the implementation outcome. Okay. In one IR, you can explore more than one implementation outcome. So, for instance, I'm questioning about acceptability, but also, on the other hand, I would measure about the coverage, because the main question of my IR is why the measles immunization in Indonesia low in its coverage. So that's why I also measure coverage as an implementation outcome. And then when I introduce, for instance, mass campaign by religious leaders, then I would also mention the changes of the coverage. So it's a measurement of the implementation outcomes. I can measure acceptability as an intermediary implementation outcome to the coverage. But I also want to measure the coverage as the also program indicators. Okay, so the selection of the implementation outcome will depend on the stage of intervention. If we have a new innovations, new proven innovation, and we would like to introduce in the real world setting in the program, then we can questions about acceptability or maybe adoption. Adoption is how the intention or initial decision by the stakeholders to a new intervention. So for instance, it's about the uptake, utilization, that's related to the adoption of the new innovation. Appropriateness, this is something also in the early stage of implementation. Appropriateness is the perceived fit or relevance of the intervention in particular setting. So about the fit of intervention into the setting. That's appropriateness. Feasibility. Feasibility is something about that the intervention, the innovation is doable, is applicable in the real setting. And it can be also sustainability, particularly when we dealing with the question about scale up. If we do the implementation research on well-established intervention, we can measure fidelity and cost and coverage, for instance.
I just want to motivate a discussion about in the online session, there is when you mention the outcomes, the classification of the outcomes are in 3 groups. I remember the implementation outcomes, the service outcomes, and the first one
Patient outcome.
Patient. And one of those is effectiveness. And I know that there is a lot of discussion about if effectiveness is part of one of the outcomes of implementation research. So I just want to bring this up to discuss about that, because I know that there are different positions about that.
Okay. So I would like to invite other opinion about that. So we know in the online module, we know about health system outcome, and then provider's outcome, or service outcome, and then patient outcome. Yes, Phyllis, please.
So we had this discussion already, so it's just going to be a repetition of what we said. In my opinion, I think the differences between efficacy and effectiveness needs to be clarified first. So if it is about whether the intervention works or not, I prefer to use the term efficacy. So the efficacy of the intervention. In that case, I would say that no IR question should focus on efficacy of the intervention or the innovation. When you move from that level to effectiveness, because effectiveness looks at how the intervention works within the real world, sometimes you are likely to have IR questions that are looking at the effectiveness within real world setting, but not the effectiveness of the intervention as a whole. Exactly. So I think that it's the use of the terminology, and I always say, just like intervention, the use of the word intervention. You rightly explained that when we are looking at the evidence-based tool, it's an intervention. When we are looking at the strategies that we use to push it, it's implementation strategy.
Yeah.
However, we always conflate the use of those words. Intervention, implementation strategy.
Yes.
So when it comes to IR, I always say that you need to understand what you are talking about, so that when you are explaining, it's easy for you to conceptualize the questions that are related to IR. Okay, and I hope that that is clear. From my side, that's what I would say.
Okay. Yeah, I'm agree with you, Phyllis. So, IR is dealing with the efficacious innovation, but maybe not working in the real life setting, or this is a new efficacious innovation we would like to apply in the real life settings. That's something related to IR. Okay,
If
and
I
then
can just add to that. So I think the distinction is that. The distinction is the controlled environment for testing versus the real world setting.
Yeah.
If you have a controlled environment with very strict inclusion, exclusion, and you're controlling everything else and you're just trying to see how efficacious something is, that's efficacy. The minute you bring it out into the real world, you're talking of effectiveness.
And then to terminology, the intervention and implementation strategy. So the innovations called intervention, or the policy or the program, that's intervention. But in IR, we can test a certain practical solution that Phyllis mentioned to push the effectiveness of the intervention. That's called implementation strategy. Okay. So I just
also wanted to ask this question. When we look at the characteristics of IR, and we see that it's demand driven, just trying to push researchers to engage with implementers and other stakeholders. In your own view, and like working with other participants, do you see the feasibility always? Is there a challenge to get researchers to talk to the implementers? How if there are challenges, how are they able to resolve those challenges? I just want some experiences.
Yes.
Yeah.
I think we will discuss that in the session about stakeholder engagement later on. That's one of the topics that I would like to discuss. Yes.
Sorry. I want to ask about the generalization. I mean, if the intervention have a lot of context, let's say in Indonesia, they have a lot of context, how to generalize it?
Yes. So it's context matter. It's generalizable when the others in the other setting, they have the almost similar context with the ones we had in that IR. So it's generalizable to other setting because in IR we explore very much the context, so that if someone else from other setting we would like to use the findings from this IR, they can use the findings that is relevant to their context. Okay, so that's why it's generalizable, because we explore about the context.
Can I also add to that?
Yes.
So in IR projects, typically you are not chasing generalizability. You are trying to find local solutions for local problems, which is probably very, very context specific. However, you are able to do one level of abstraction, which is to take out some kind of lessons that you have learned, which will be applicable to more areas which have similar context. So one part of your results is to look at how can this now, are there lessons I learned, and can this now be applied to other settings? But the exact interventions that you did is very, very context specific and cannot, as it is, be taken up and applied elsewhere. So you are not chasing generalizability in an IR project. You are looking for local solutions in a local context. However, you can do one level of analysis, which is to look at lessons largely learned, and those may have applicability or generalizability to others. But it's not very specific to,
Yes.
Just a question. So when we talk about, because now when you presented, it was only what is called implementation outcomes, because there are 3 categories. So then, does it mean then the client outcomes like satisfaction or the service, like if it's efficient, or equity, patient-centeredness are out of the scope of IR, or are, because I found that very confusing. It's very hard to, so
Yeah.
it is or it is not.
Yeah. Okay, thank you for that question. I think that's a part of the IR because that's actually the indicators about effectiveness. You remember what Phyllis mentioned? In IR, we are dealing with the measurement of the effectiveness in addition to the measurement of the process. So that's a part, I mean, for instance, patient outcome, that's a part of the IR. But not only that one. We have to explore, we have to measure other outcomes that represent the process. For instance, the patient satisfaction, that's the product of maybe the other indicators about the acceptability. So we have to measure as well about their acceptability in addition to the satisfaction. So maybe Dorothy, you can
Yeah, just to add to
on.
that, I don't think it's a very useful classification and it may be confusing. But when we use the implementation outcomes that Ari showed, we use terms like effectiveness, acceptability, adoption. Essentially, some of the service outcomes and client outcomes will be part of your effectiveness, for example, or will be part of adoption, for example. Did they find it acceptable? Were they satisfied with it or not? Those are the kind of questions you will seek to answer. So they are very much part of IR, but I don't know if that classification is very strict or you can really segregate them. They will overlap. Some of those outcomes that they are mentioning as client outcomes are actually part of effectiveness, depending on how you want to look at effectiveness. Is it only purely in terms of treatment, or are you also looking at effectiveness in terms of were patients satisfied at the end of the day? Was there a timely intervention? So you may use some of those outcomes to describe effectiveness, adoption, and acceptability.
Okay, maybe I add also, one of the characteristics of IR is complex. It means that sometimes we measure multi-scale indicators. So it's not only from the patient level, but also the healthcare services level, or maybe more macro level like health system. So yes, that's an add-on what Dorothy has mentioned. Yes, Clara.
Okay.
Okay, I think we still have more exercises to try to clarify that terminologies, that perception later on. So I think I end this recap session right now and then hand it to Dorothy.
Yeah,
please.
I think the next thing is group work. I think we all work now on our protocols. I'll request Diljit to just put out the exercise instructions. The template for the exercise. Okay, it's already shared. Great. Okay, great. So the template is there. The instructions are clear. Is to look at your protocols now. Yeah, you look at your protocols now in the light of these characteristics of IR. And you try to identify why your project is an IR project and clarify some of the justification and the research question. Yeah, if you all have problems with getting the link, we can come around and check that.
Yeah, we will work with the IR protocol, and this is the systematics of IR protocol. Usually covers 5 parts. First, about the introduction, and then research design, project plan, impact, and the others, the annexes. So the templates that already shared actually use this format. So we will work with the introduction first, the rationale, and then the IR objective and problem statement. So start with that, okay? Then we move to the research design after the lunch. So let's start the work.
Okay. So we are the first to start, but we changed a little our subject to be applied to implementation research. So our project title will be the integration of psychological support and community education in the CL control program in Tunisia. Is a major health problem due to its high incidence and significant cost of management and treatment. The disfigurement and permanently disfiguring scars may create a lifelong stigma and have a significant psychosocial impact, especially among women. In fact, given the role in this society, any impact on the well-being of these women will have impact on the family and community. Unfortunately, this aspect is not included in the National Control Program of Leishmaniasis, which is more focused on treatment and vector control. So that's why we aim to integrate psychological support and community education in this program to improve the quality of life. So the general objective will be to implement psychological support and community education in the National Control Program to improve patients' quality of life. We will not stop in women, so we will involve even men and all CL patients. Our specific objectives will be to adapt case management and improve psychological follow-up, to customize community health education, to reduce stigmatization, and to advocate for the promotion of psychological support. Our research questions will be with this integration of this support and community education will be feasible, and in which extent will this improve CL patient psychology and quality of life. I think that's all. Yeah, thank you.
Okay, thank you very much. So please, question, suggestion, clarification?
So yeah, I think that this will come next in the study design, but we are thinking about making before and after intervention, or like to question people if they have felt this change in the psychological support, and if this beneficial for them. This will come next. We didn't think about this yet, but.
Other question, suggestion?
Okay, maybe I can just ask, does everybody feel that this is an IR question? Is there somebody who feels that this is not an IR question?
I think the first one to me looks like an IR question because you're looking at feasibility. The second one, you're trying to see if this intervention is going to be showing some results. But you've been saying that it's about using proven interventions to see how you can implement it. So I'm thinking maybe the second one is not the most appropriate research question, but maybe the first one isn't.
Okay, other thoughts? And what are you thinking when you were saying IR question and you're trying to evaluate it? What are the things that are going through your mind?
If I may, I think the key thing would be that we move our focus from the tool itself to the implementation processes. And I think I was going to ask if that supported the re-engineering of the topic again, and I think so. Maybe if they can tell us a little bit about how they shifted the focus from just looking at the health problem to focusing on the implementation processes, that would also help us.
Yeah, so I think that's a good question. how do we generate IR questions is where I was going with this. How do we generate IR questions? Where do they come from? It's been taught in the class also, it's not something completely new. Where should IR questions ideally come from?
Is it from real life?
From real life
Problems?
From the programs?
Indonesia wants to answer. No?
Demand driven.
Yeah, so it's demand driven, and that's the word that's used in the online component only. What we mean by demand is it is an implementer demand. The implementer wants to know how he can improve something or overcome a problem he is facing or see how they can do it better. So this is not typically in that sense implementer driven, but it may also be from patients, and it could be a patient driven question or demand. So, but the question has to be rooted in a problem that is being faced, and then it becomes very much IR. Also, the outcome is what you would look at to say whether this is IR or not, because they are looking at feasibility. It is very much an IR study. So, I think those are the key things you would look at to assess whether this is an IR problem or not. Where is the question coming from? And what is the outcome I'm looking at? And that is what will determine whether this is IR or not.
I will add a comment about the rationale. Could you come back to the slide about rationale? Yeah, here what I want to suggest is the emphasis in the implementation problem. I think somehow it should be more strengthened. For instance, you can show that actually the program about CL is already in the field. It's become the national policy, something like that. But maybe there was something with the implementation problem. For instance, the adherence of the patients to the program is lacking because of maybe psychosocial problem related to CL, for instance. So, by that reasons that you adjust, that psychosocial problem should be addressed to improve the implementation of the program.
I thought about this, but in our case, I think the patients want this. So it's not like something they will refuse. So it's quite different from the others, like a new intervention, because for this, I think everyone will, and I know, like maybe from other results or something, that if we go and we say that we will support you in your psychological and social aspects, they will be taking this. So that's why it's not really a problem. It's more regarding the policy, maybe.
Yeah, but I think what Ari was trying to say is, why are you trying to bring this policy change? And that little bit of justification is missing. It may be that patients want it, but does it justify putting your resources into a national program for that policy? So where is the evidence to say that this is something that will work, that it is lacking in the current program, and that is why you are thinking of putting it in? So just that 2 lines on justification to make it clearer that there is a gap in the program. This is something that will improve that gap, and so you are trying to look at this program.
And then one more suggestion, maybe here you can use previous systematic review or something like that about psychological support and community education. You prove that that kind of strategy actually something that already efficacious, but you want to adapt that in the context of CL program, something like that.
Thank you.
Any other questions, suggestion? Okay, thank you very much. Thank you. Second presentation, I would like to have Philippine. Is that okay? Yeah.
Okay, we're currently applying some learnings in our
Only one more time, okay.
So as the discussions go, there's also
You want? Yeah, okay. So please.
So there are some challenges in treating CL. So it's a recognized public health problem in the country. There is a national program that provides the treatment for free, but the problems with that is that the majority of cases, and the program has certain conditions. So you need to have a confirmation of diagnosis to get access to the treatment, and then you need to have a facility where you can get the intramuscular injection applied every day. Otherwise, you will not get the drug. They will not release it to the patient for different reasons. But the problem is the majority of the cases occur in rural dispersed areas. That means that maybe there are not facilities available. And there are some previous work that have shown all the indirect cost of the patients, a facility every day, and so on. So there are a lot of burden that is posed into the patients because of having to be treated. So we believe that that represents a problem for accessing the treatment and also to the compliance, which we don't know to what extent, because in Colombia, leishmaniasis is a notifiable disease, but it stops there. So you get notified, you know what treatment you were prescribed, but after that, nobody knows what happens with the patients, unless they are like in a study or something. So I think we have shown this before, so just to give you a sense of how challenging can be reaching a health facility. Because, for example, this is one of the sites, and all of this is the extent of the municipality, but this is the road. So accessing is quite challenging. So we want to reduce some critical knowledge gaps in targeting evaluation of interventions for the control of CL, because we lack of certain knowledge about how does the intervention work in real life condition. So we only focus in one of the aims of the study, which is to estimate the effectiveness of the standard of care for CL in 3 locations, supported by using mHealth tools, like it's a way to capture all this data, managed by participants or by community health volunteers. So we put here is not like specific aims, they're like indicators of the project. We are EPPE trainers, so we want these mHealth tools adapted and validated to be used by these community health volunteers. So there are previous studies where the mHealth tools were developed and assessed. But as we are going to apply it into different settings, so we need to adapt it probably. We want to estimate the compliance to the treatment and the frequency of adverse events in the routine conditions and the treatment outcomes for the 2 main drugs that we are going to estimate that it's going to be used, the oral drug, which is miltefosine, and the intramuscular, which is glucantin. So these are our questions. So what's the compliance and the frequency of these adverse events in routine conditions in rural areas of the country where we believe there's the biggest problem? What is the effectiveness of this intervention under routine conditions in rural settings? And there are some, we call them sub-questions, because there are things that are not targeted by the main study. So we are going to assess the performance of these tools to determine the therapeutic response, and also how if they actually work for or help to assess the therapeutic response or not. And if we get funding for this, the acceptability and usability of these tools for the community volunteers in other places that are not Tumaco, because this is where they were developed in the first place.
We're just shy to ask because it's Doc Marie. Can we just see the implementation? Yeah, no, the first one, the IR problems. Forward. One more. there to estimate the effectiveness of the standard treatment for CL. So maybe I just don't understand the project so much, but I don't know how to state it, but I'm not sure if it's an IR study because you're estimating a particular treatment. So I'm not sure. It will bring so much light if we further discuss there.
It's a valid question, and I think we have it ourselves too. So this is the standard so this routine conditions. So we are not going to make any changes on how things work, but the policy in the country is designed, I think, from Bogota, where life works very differently to the rural places. So I don't know if we mentioned that there are different challenges when you okay, how to say it? So it might be possible that the drugs, they are effective. So they are proved. We know how is their efficacy, which is very good for the species we have in the country. But there are a lot of access problems, and there are a lot of other issues, and we don't know how they work in real life conditions. So we are rolling out an intervention that is proved efficacious, but we just don't know if they are working in the real life where the disease is occurring, which is in a rural place very far away from where the healthcare facilities are located. I don't know if that was...
Yeah, I think we have similar problems because we have a proven intervention, but we are not yet sure how it will work in the community. So I just thought it's easier to see if it's an IR problem if, for example, you're looking now at how it will be rolled out or done in the society more than looking at the treatment per se. Because then that will be another phase of an efficacy trial because you're not yet sure whether it's working. That's why you want to see if it works in a particular setting. And it sounds to me so much like an efficacy problem there.
Yeah, no, I just wanted to add to that. So I think what's creating the confusion is the terms of standard treatment for CL. So what you're actually looking at is the national program for CL. Yes, it's not really looking at a treatment per se. So you're looking at how effective is this national program in actually dealing with CL in these hard-to-reach rural communities. So they're trying to study effectiveness of the program, not so much a particular treatment.
And also, to add to that, I think it's just refocusing the question, right? Rather than making the estimation more active, can we focus on the IR strategy that we want to use? That's the use of the mHealth tool, because that is what we are looking at as a vehicle to push the intervention. So just a little bit of tweaking to refocus and have the mHealth tools as standing out more than you looking at the efficacy bits of the standard tools. I think that would also be helpful.
Yeah, we thought about that, but the thing is that in this project we want to use the mHealth tools more as tools for collecting data. So we are not interested in measure the implementation of the mHealth tools. But yeah, so we want to. The thing is that we want to, we don't want to change a lot the project because we want to get the best of this experience to actually apply to the project. So that's why I know it's going to be challenging and we are learning also in that process, but yeah.
So I would like to suggest, because this is just an exercise that we somehow develop an IR protocol, right? So even though you have already an existing plan for that project, but what I would like to suggest is how to switch if in this we want to develop some kind of IR protocol. So, for instance, in the rationale, you mentioned about the implementation problem of access. Yeah? The implementation of problem of access in the rural area. So it means that if we make that as an implementation research project, then in this project, we would like to improve the access to the standardized treatment in the national program. So I'm thinking that's the missing link, because in the rationale you mentioned about access, but then in the objective you mentioned about health. There's maybe something with more about what I was thinking the same with Phyllis. It's more about utilization by the community. So I think how to make it synergy between the rational and then the objective and the research question should be refocusing. I am agree with Phyllis. So maybe Bara and Dorothy can help.
No, it's okay. You can spend some more time thinking about it, but I'm okay with the way you framed it now. For example, for what I understand is mHealth is a tool that you are going to use for data capture, and that's not an implementation strategy. The main thing that you're trying to look at, it's like an evaluation of a national program. They're trying to see how effective has this program been in curing people with CL in these very hard to reach rural areas. And they don't have that information as of now, is whether people are getting cured, not getting cured. So it's more of the evaluation of the national program rather than intervening. They're not implementing, they're not doing any intervention.
And I would like to suggest that the additional question about what are the barriers to the current implementation of standard treatment should be there.
Yeah.
So not only the estimation about the effectiveness, but also what are the contexts, what are the factors related to the effectiveness of the.
Yeah. I agree with Ari. I think that would qualify your question well. So you're studying effectiveness in terms of, okay, these many people did not get cured. But then what are the problems is the next question that's going to follow. So it's worth already getting that information to understand the barriers to good treatment or good cure.
Okay. Thank you.
Thank you very much. So the next is Swara.
So when we're talking about the barriers, then are we bringing in a qualitative component?
Yes.
So it's like trying to talk to those people who probably dropped out or things like that to try and understand from them. So is it the qualitative component?
Yeah, so we'll discuss this more in the design and methods.
Sure.
I think the way you frame the question will lead to what kind of methods you will use, but when we say barriers, it doesn't always mean qualitative. You could mean barriers in terms of distance, and that could be a big barrier. So it's just measurement of distance and telling from, it could just mean how many people are living within a hamlet, what the family size is. So you can quantify barriers also. So barriers per se does not mean qualitative, but how you approach it and how you frame the question will determine what method you choose to use.
We were informed that it's obviously an IR, so this exercise I'd say is really helpful. Yeah. So this is our study, the rollout of G6PD screening and WHO treatment guidelines for malaria patients in endemic areas. So the background is there is lack of G6PD screening in our country so that we could adhere to the WHO treatment guidelines. And the absence of G6PD screening caused the current national guidelines has. So we put here that G6PD screening has already been with the WHO treatment guidelines is already a proven intervention to allow for proper treatment of malaria. And we recently conducted a stakeholders analysis which showed acceptability and usefulness of the G6PD screening to the community. However, there was an expressed lack of capacity. So our IR problem is, will the stakeholders involved in G6PD screenings and the use of WHO treatment guidelines be able to adopt this intervention in southern Philippines? And And objective of that is to determine the adoption of G6PD screening and WHO treatment guidelines in a rural setting with limited resources. And the specific objectives is, first, we actually wanted to add more on this because we know that there will be more factors that we could look at. But the given time only allowed us to put some factors that we had to discuss lengthily if that is really the factor that we want to look at in our study. But again, I think this is a very useful practice in developing research questions. So one of our objectives is to determine the capacity of village health workers to use G6PD screening test kits, because the stakeholders' analysis showed that they expressed that they need more training and counseling for that, and also to describe the changes in policies on the use of G6PD screening and WHO treatment guidelines for malaria treatment, since this had been recommended by the National Malaria and Elimination Program director herself. So our research question is, what factors affect the success of adoption of G6PD screening and the use of WHO treatment guidelines, and what are the basic requirements needed to effectively roll out this program in the setting? So that's our refrained study questions for this exercise. Yeah, because thanks for clarifying, because I think I missed explaining the context of that, because currently they are exploring to, of course, follow the WHO treatment guidelines. So I'm not sure, depending on the timeline that this happens, we want to see if there will be changes on the process, since we have previous studies that already show the effectiveness of G6PD screening, the efficacy of G6PD screening. So there are, Charm, correct me if I'm wrong, there are policies that are being lobbied, or there are recommendations that had already been provided. So we want to see if on the rollout of this G6PD screening, will there be changes in... Maybe we can reframe that to say that, will there be additional recommendations, or will there be further? Yes, will it be? Yeah.
Contribute to change in policies,
yes.
Maybe. Then that.
Yeah. Thank you. We reframed it much better when you clarified. Determine capacity of village health workers. It's mostly on. We're also discussing that. But I think there are a lot of capacity assessment methods. Like, one is post and one is, of course, you have to establish a skills assessment. We're thinking of putting in a skills assessment questionnaire. Or you could also see how well they are doing with the test kits. You can monitor the results of their... when they do it in the field, you can monitor the results that they put out, and then you can put in controls and regular checks for whether they are doing it correctly or not. But you just have to document the whole process of how they are using the test kits.
But how is that different to assess then the performance of the kit by using... by those users?
Sorry?
So how would you say, it sounds to me like assessing the performance of those kids by the community health workers.
Yes.
Because I'm not sure what capacity really means, but it looks like by what you describe is more like the performance in the field of those kids.
Capacity of... it's the capacity of the village health workers to use the kit. It's more of a competency assessment. Yeah, the competency of the village health workers to use the test kits. Not the kit itself, it's the competency of the ones using it. Yeah.
So in that case, I was thinking, I don't know if it can be rephrased in a way that that stands out, because like capacity could
mean a lot.
Yeah,
Okay.
several other things, but in this case, in relation to their ability to deliver a service, that's what we are looking out for. So if we can look at that, that will be helpful. And I think because we are having this, it might not be related to this. Sometimes when it comes to implementation research, because of the interventions that we want to put in place, redefining objectives becomes difficult. Sometimes it sounds as if it's an activity objectives, and how close or far would that be from research objectives? It's difficult for you to think about, but I think it's something for us all to just ponder on whenever we are putting down some of these objectives, whether they can really sit as research objectives or just activity objectives.
I think I like the way you put it across. And sometimes I think, why are we having these general and specific objectives? Maybe some of these specific objectives actually look to me like the activities that you are going to be performing to be able to achieve that one. So maybe we don't even have to fill it as specific objectives, be very clear on that. I'm just seeing that way as
I also wanted to allude to the same thing, but I also want to reiterate the point Phyllis made, which is sometimes a distinction between program and the research is not there. So we need to constantly check that the research question is there and we're not just about the program. So I think that's a good point. The other thing is about it's a general comment to everybody. When we write objectives, and if you're going to break it down into specific objectives, then you need to have coherence of the specific objective with your overall objective, with the overall goal. So as of now, the specific objectives are detached from your general objective. You talk about adoption, but there's no adoption in the specific objectives. So the specific objectives are breaking down further your general objective, and your general objective is a little bit more clarifying your goal. So that's the path, and that's the kind of coherence you have to build into. Each of these should speak to each other. Your aim is in coherence with your objective, with the specific objectives, with your method, design, data collection methods. There needs to be a line running right through each of this. So there's the specific objectives to be reframed.
Yeah, we recognize that. We're just not, I think we could have just stuck on the general one or one objective, because we are still not sure how to do an adoption study. So we could look further on, the aims that would lead you to achieve that objective. So thank you for that comment.
I'll add some comments. It's about the adoption. So maybe you can clarify more. In which level is the adoption? Is it district level or provincial level? Because you mentioned that it's already in the national policy, right? So maybe in that context should be more clear.
Okay.
Yeah.
Okay.
We are yet.
Just to comment, the G6PD screening and the WHO treatment guidelines is not currently practiced in our country, so that's why. To answer your question, it is not practiced in the country, so that's why we want to pilot test it in the rural areas where malaria cases is endemic, and we want to put into place that all patients will have access to those facilities that we will deploy the G6PD, where we will deploy the G6PD screening and the treatment guidelines of the WHO.
Thank you. And the second comment is about maybe some additional research question about the acceptability of screening by the patient. So that can be one thing that should be think about.
Yes. Thank you for mentioning that. That will be included in our consent form or informed consent form, stating that they will be explaining that they will be participating in the study, provided that if the collection of blood for the G6PD screening and the G6PD screening are okay to them. So that's it.
Yeah, that's not the same thing as acceptability. Informed consent is to say, do you want to be part of my research study? When you study acceptability, you're trying to see, did they like the test? Or do they think they're not going to come back again for it? It was too painful, too much blood, or those kind of things. Is it acceptable as an intervention to them? So it's a different thing to study from the informed consent.
Can I ask for examples? I'm asking. Can I ask for examples where you looked at something like that? Because to be honest, we may have to look at a study such as that, or it would be helpful if there would be an example of a study that look at that.
Yeah, there are plenty of studies. We can point you to some literature
Okay.
on acceptability and adoption studies.
Great, thank you.
Thank you very much. Very nice presentation. So next will be Ghana.
The topic didn't change. Still looking at improving community-based implementation of WASH interventions for the control of cholera in the country. So the background did not change, but I will just give a few emphases. So we mentioned the fact that cholera is endemic throughout sub-Saharan Africa, where we have 200 million people at risk per previous studies. Now, some few images, I think we had mentioned how about substantial communities in the country were affected in 2014, and a few images on this side to show us the terrain when we describe the hotspots, how they are likely to be like. So some densely populated areas with access to supply of water highly limited. So the IR problem statement, I think this is what is of interest to us now. What we are building off the background is that in Ghana, it has been observed that long-term WASH programs do not regularly prioritize the areas that are affected by cholera with proactive targeted strategies. So it's like we are generally implementing WASH as if all the communities are one. So not taking context into, or recognizing context. In addition, a study that was done by Ohene, who is also an implementer, they identified a few barriers, possible barriers that when it comes to cholera, there is incomplete and inadequate analysis of surveillance data. Again, meaning that they don't disaggregate to understand what is happening in the different communities. Suboptimal community-based surveillance, late reporting of deaths in the community, which is a problem for us because we know that cholera is highly contagious. So when there is a case and it's not reported, then it means that it just sweeps. And for us, one of the key things that she mentioned in her study is the inadequate community knowledge about cholera. I think that leads us to what we want to do. And in 2017, the GTFCC released a roadmap, and what they mentioned was that although there are strategies to prevent and control cholera, there are strategies that are known and are efficacious. There are problems because we have the regular outbreaks. If you have the intervention and it's efficacious, why would you continue having the outbreaks? But once there are the outbreaks, then it means that there are a problem. What they say is that it demonstrates that current strategies, implementation strategies that are adopted to promote the interventions have failed in one way or the other. And we use the Ghanaian case as an example of failed strategies by going back to the 2014 outbreak that we had, the number of cases, and unfortunately, we becoming part of a trial that contributed over 83% for the cases and also the number of deaths that we had in the sub-region. So what is our research question? We positioned it first. For us, the first key question that we want to answer through this implementation research is what contextual factors and determinants hinder or facilitate adoption of WASH interventions within hotspots in Ghana. And for the contextual factors, we hope that these objectives will help us achieve them. First, to assess those contextual factors and identify barriers, as well as facilitators that influence the adoption of the WASH practices in these hotspots to inform the design of a tailored intervention that will be done along the line. And the specific objectives to explore awareness, knowledge, perceptions of cholera, diarrhea-related diseases, and WASH practices. So what is currently in practice, we need to understand that to be able to come up with the intervention. To determine proportion of households that practice WASH. We want to see the level of adoption of WASH practices currently. before we move, and also to describe the patterns of health-seeking behavior for diarrhea-related diseases. So that's what we have for now. Take comments.
Thank you very much. Comments, please. Dorothy, please.
I was just wondering about you want to know barriers and facilitators, but in your specific objectives, you're stopping at knowing, awareness, knowledge, and perception. Will you, from the 3 specific objectives you've written, are you addressing the barrier facilitator question or not? Because this will affect your design.
Yeah. So what we were thinking was that when they tell us what they know currently, in terms of beliefs, knowledge, and whatever, in there we can identify some of the barriers in there. And for the facilitators, I don't know, Franklin, we're talking about some of the mechanisms.
Well, what we intended to do initially is to present work package 1, to have the systematic reviews, the interviews, and then the survey. That will help us to identify the key factors and variables that will help us to now design our strategy. And that also include trying to test for its acceptability. Okay, so essentially that's about.
Yeah. But how are we going to identify the enabling factors, the facilitators, for instance, through the process?
Well, first we try to identify the behavior change techniques and then mechanisms of action. And we try to link the two and then develop a behavior change wheel, and through that we're able to identify the specific behavior change strategies that will help us to do this.
And especially for the facilitators, we wanted to focus on self-efficacy, for instance. To what extent is self-efficacy as a mechanism, like become a facilitator? Do they know already? Are there aspects of this that they have been exposed to? Can we already build on what they know, build on it, rather than start from the scratch? So these are some of the things that we are looking at. But obviously, we will need to add more. Yeah. We need to add more things.
Yeah, I mean, not particularly add, but also reframe it. Because if you leave it like this, the problem will be, you spoke about self-efficacy and you may use it as a method, but then there's no coherence with your objective. So you want to expand that further to say you also want to know why they do the practices they do, and then that will address your...
Exactly. Yeah, I think so.
Any other question?
Especially for the facilitators.
I want to have a clarification whether in the hotspot community that you mentioned there is a communal WASH facility. If it is in the context, then you can raise a question about utilization. That's a part of the the second specific objective, right?
A common
communal WASH facility.
Oh, okay. So WASH will basically refer to water and sanitation and hygiene practices generally. So if in the community there is, for example, a common source of water, common source of toilets that is used, yes. But we also want to break it down to the household level because of some of the enabling factors. The enabling factors, we know that will start with the individual. You look at the family before you go into the communal level. So we need to structure it in that sense to look at it. But yes, for these communities, there are several facilities that are used communally. Yeah.
So I think it will, what they mean by WASH will include that proportion also. How many are using a communal?
Yeah, definitely.
Any other comments? Thank you for the good work.
Thank you very much.
So the last, Indonesian.
So before that, we'll show you the situation in the prison in Indonesia. It's like maybe similar to the other countries. And why prison? Because prison is TB reservoir, and the incidence of TB is much more higher than in the general population. And based on the report, TB is number 4 disease occurs in the prison. And also TB is number 2 cause of death in Indonesian prison. And based on the previous study, suggested that fidelity of TB screening program in the prison is low. We all know that TB is a health problem in the prison, while screening itself, it is proven to be effective to reduce TB incidence and prevalence in prison. We have, in Indonesia, we have a TB screening program, we have TB program in the prison. However, the fidelity of the program is low. For the screening program, there are four types of screening. It is entry screening, mass routine screening, contact screening, and release screening. However, in the prison, the one that is conducted is only entry screening, but use no symptom screening from the standardized one. And there are no mass routine screening, no contact screening, and no release screening. And what are we going to do? Agent. Armed with skill in symptom screening and skills in TB education. We choose those types of skills because we need the TB education too, because in the prison, inmates is dynamic, so it's come and go. So we need train the inmates to train the others, so it will be sustained, something like that. And the general objective is to assess the feasibility of implementing strategy of TB screening agent in the prison, because it is actually implemented in other prison in Jakarta, but not in Yogyakarta and Surakarta. And the specific objective breakdown from the general one is to conduct training on TB education and TB symptom screening for inmates, to assess the readiness of the institution and the inmates, to assess the acceptability of the stakeholder, to explore the challenges and barriers, and finally to assess whether this will sustain or not. We have so many research questions because those are what we need to obtain during the data collection and during the research, seeing from the objectives. And from the feasibility itself, from the framework, there are several constructs that we need to, the data we need to achieve to assess completely the feasibility. And that's all. To assess the knowledge before and after, to how's the readiness, how's the acceptability among the inmates, prison staff, prison policymaker, how's the engagement between prison and other sectors, and how to improve multi-sectoral engagement, because from the previous study, it is a bit lacking from the multi-sectoral engagement. And what are the challenges? How to sustain this program? Specific objective, it is readiness. So readiness, there are several constructs from the readiness. Some of them are knowledge, skills, self-efficacy, perception of themselves among the other organizations, something like that.
I just have a comment with the first specific objective.
Yeah.
I think it was already mentioned before. So it's a difference between doing an activity or a main step of your project and a name. And to me, that looks like an activity you're going to do.
Yeah. Yes, it is an activity.
Any other suggestion, Vara?
Just this terminology, TB screening agent. They put TB agents, and I said, are you going to even let the TB bacteria into the thing? So I'm not able to come to terms, is that the right terminology, or what do we think about giving them some idea on what could be an appropriate, So I'm not so happy with the TB screening agent.
I think it's just a jargon to us to easier to remember something. Maybe we can revise, asking for the advice.
I just want the research questions. So there are too many, and too many is problematic. You have to condense them, combine them, choose. Yeah. The first three of them sound like effectiveness to me, but effectiveness doesn't come into your specific objective. So are you also trying to assess the effectiveness of your program, or are you only looking at feasibility?
Maybe this is the way I frame the question.
No. So, but do you want to look at effectiveness? And if you do, then that needs to come into the question. You need to say to assess effectiveness and feasibility of the strategy.
But we don't think to assess the effectiveness.
But don't you think that's also important? Because this is not a proven intervention. This is an intervention you are putting into place.
Yeah.
And people would want to know, did it really improve knowledge? Does it help to decrease or to detect TB early?
But in other prison, in other cities, they implement it, and based on it is informal conversation actually. The doctor told me that this works, and
Okay, fair enough. So you are happy with the effectiveness, and you want to look at only feasibility.
Yeah.
Then from your research questions, maybe you want to take the first three off, because you don't really want to see did it really improve knowledge or not. Because that is going into the domain of effectiveness.
Okay.
So then you want to focus your research question only on looking at feasibility.
Okay, thank you.
We've been talking a lot about context. So how sure are we that it works in Jakarta, it should work here in Yogyakarta? In fact, you said they have a good screening program there, but not here. So how do I believe that something that works in X will also work in Y? So I would rather say that if you're looking at a new intervention, look at feasibility and effectiveness, then combine all your questions together, right? What's the guarantee? People are so different,
okay.
right?
Thank you.
Context comes into question.
We'll add in our objectives.
I agree with that suggestion. Yeah. And in the rationale, you should also mention that the TB screening agent in Jakarta has been proved to be effective. So something to be the rationale in other contexts, it is effective already. And now you try to implement that in other contexts, in Yogyakarta and Surakarta. So I think it's very important to mention that in the rationale. And the other one is a suggestion, because you have plenty research question. So in IR procedure, you have somehow you have to mention that you have to prioritize the question together with the implementers, of course. Yeah, in order to get some kind of insight whether that's something that important in the real context from implementers. Yeah.
Because when we put, actually there were only 5 or something, and some things popped up in our mind, so we just edit.
So that's usually the process of developing the IR questions. It is not just our insight, but we usually give feedback to the implementers and get some insight from them whether the question is really something that they perceive important to be answered by the research.
Yeah.
I think that's a very important point that Ari has raised. I think all our projects currently are from researcher perspectives. But how are you going to engage stakeholders? Is it something of importance to them? Do you need to inform them about the problems and get them on board? Is, I think, already something to think about.
Okay, any other suggestion?
Yes, I want to say that I think that some of these questions are more, to me, it looks more like outcomes. So maybe you want to, in your objective, you can be a little bit broader. Diljit, can I see the general? So maybe we don't want only to assess feasibility, but to assess the effect of the implementation of the program. And then in the question you have sustainability, acceptability, other different things. Those are outcomes that you can measure from the more general objective.
Thank you. Maybe we'll just list all what pops up in our mind, and we'll just consult to the stakeholder and which one is priority and which one should be deleted.
Thank you very much.
Yeah, I think everyone's progressed quite a bit. And yeah, are you all happy with where you are with your questions? Okay, so we finished half an hour earlier than as per schedule. So I want to ask all of you whether you want to get into design. I could do the recap quickly. Or do you want to take a break and...
I think pre-lunch is better because post-lunch listening to lecture also can be difficult. Yeah. Yeah. No, whatever it is. Whatever.